International Nurse Researcher Hall of Fame. I am honored to introduce to you these esteemed nurse researchers as we conclude the 22nd International Nursing Research Congress. Have you enjoyed the Congress? Okay, I hope you're inspired to join us for many more in the future. Today we are honoring 15 distinguished nurse researchers. This unique recognition eternally honors Sigma Theta Tau International members who have achieved long-term national or international recognition for their work and whose research has impacted the nursing profession and the health of the people it serves. The presentation of the International Nurse Researcher Hall of Fame is sponsored by Wiley Blackwell.
My practice was in public health nursing, and I worked in an official public health department, and within that role I worked as a school nurse, so I was very involved with elementary, middle school, and high school students as a school nurse, and also I served as a coordinator in the WIC program for women, infants, and children. So my whole practice base was in public health in the official arena. And I enjoyed those experiences tremendously. It was a wonderful experience, and it was from that experience is what really moved me from the practice to the research.
Many of you know me. I am passionate about evidence-based practice, and I have been so blessed with my wonderful friend and colleague, Dr. Ellen Feinau-Overhold, to travel throughout the United States and the globe in working with practicing nurses and healthcare systems about how to implement findings from research into clinical practice to improve care. And I'd really like to say, through all our travels, it is so obvious that when we continue to teach research the way we've always done it in our educational programs, it develops a sense of negativity in practicing nurses.
Well, I have been blessed with many mentors, many wonderful mentors. Probably the person that comes to mind the most is Peggy Chin, who is now the editor of Advances in Nursing Science, who was the chair of my master's thesis at Wright State University. And I was thinking when other people were talking, I too was a school nurse, Mary, and when I was getting my master's, part of my clinical experience was to go out and prevent something in the community. So I went to the population I knew. I had worked in a inner city high school in Dayton, Ohio. And so I looked to see from the mortality tables what was killing young African American women the most. And that was homicide.
There were several people that inspired me. I think early on, very early, I think it was mainly my mother who said, if you don't know something, always ask questions. And if you think about that, think how important that is, asking questions. And then in my undergraduate work, when I was doing my work, I was always fighting a battle because everyone in my cohort in the whole undergraduate program was really focused on acute care and skills, and that was the thing to do in nursing. And I was always interested in health promotion. So I was kind of going against the grain when I was an undergraduate student.
We have a tremendous need in nursing to have much more theory development. We have, particularly at the middle range level. And so if people have a topic that they think that I'm interested in this, I've seen this in the clinical area, that you go on with that, you take that, and you find other people who can really grow from, and as you learn that. That's what I've done, and I think that's what I know that has also influenced many people out there.
But again, you just got to persist. If you really believe what you're doing is going to make a difference for your patients and your family members, despite how many rejections that you get, you just have to keep going. You have to persist.